Basically, this is a paper that doesn't have findings. Okay, this is a conceptual paper. Okay, the title for this paper is Conceptual Framework for Customer Experience toward COVID-19 Preventive Measures of Malaysian Retailers. So basically, like, we all can actually related to this research, okay, because we are the customers that actually buying from the store, from the Malaysian retailers. So me as the first author, and then the second author is Dr. Suharni Maulan and also Dr. Amira Amatsuki. Three of us are coming from the International Islamic University Malaysia, Gombak. Okay. So for the introduction, within the overview, the coronavirus, we know that the coronavirus pandemic has happened in this year, actually starting last year, but the what you call it, the seriousness of the pandemic is actually within this year. Okay, and then because of this pandemic, many retailers are required, actually all retailers are required to follow new health protocol, including the preventive measures from the government. For example, like sanitization, face mask, hand sanitizer, and also health temperature check. Okay, and this paper, this study actually I'm doing on within the in-store shopping. In-store meaning that when the customer go within the store, okay, not online shopping, because there are 49% of Malaysian citizen actually prefer to do in-store shopping with whatever reason, maybe a cost reduction and so on. Okay, easier to get and all, especially for basic household. Okay, and it is important for Malaysian retailers to follow the preventive measure in order to reduce the spread of the virus. And this paper also will support the Sustainable Development Goal 3, good health and well-being by United Nations, in order to reduce the spreading of the disease. Okay. The problem statement is the unclear impact of how preventive measure will affect the in-store customer experience, or in the short form, I call it ISCX. Okay. So previously, when we as a customer, we go out to buy our household things, we take it as joyful and also a very leisure activity. Okay, because we just want to go out from our house. So this is the previously, I mean the previous time before the COVID or the pandemic. But now because the automation, for example, the online things increases, so the human contact will be minimized, and sometimes when we go to the store, we need to be in there for 15 to 20 minutes, or maybe we need to the retailers need to make sure that there's some sort of quota, so we cannot actually be in there for a very long time. So customers tend to cut short their time. They also need to feel safe within the store itself. The retailers also need to provide the customer a safe environment as well. Okay, and also sometimes customers are feeling anxieties. Sometimes we go there and then we see someone coughing, we feel anxiety, and suddenly, and then thus the customer might experience quite different from the previous pandemic period of time moment. Okay. So the research objective of this paper is to develop a framework on customer experience. When we talk about the customer experience, it does help the retailers to receive sales, increase sales, and also increase the customer numbers. So the customer experience is very important within the business strategy. This one is, we want to develop a framework of customer experience towards COVID-19 preventive measure of Malaysian retailers. So basically, the participant is actually the customer that go into these Malaysian retailers, and specifically, it proposed a conceptual framework of in-store customer experience, in the short form ISCX, and also the preventive measures within the implementation of Maslow hierarchy of needs concept. Only the two lowest stage of the Maslow we touch. We don't actually touch every stages of the Maslow. So the literature review, the in-store customer experience, we actually take from Bustamante and Rubio 2017. There are so many other measurement, but we take it from Bustamante is because this measurement is not really having a very joyful measurement, because we don't want, with regards to pandemic, it's not really joyful, and then less bias with regards to the measurement. So there are so many other authors as well, but we decide to take the Bustamante for that. So this paper will, this study in the future will do it in the qualitative manner. So within the Bustamante measurement of ISCX, it have 1, 2, 3, 4 cognitive, affective, social, and physical experience. So basically, the experience is talking about the physical stores, the environment, the interaction between us and also the other people, the employee of the stores, and also maybe the flow of the stores. At the same time, the flow of the people within the store. So everything is included inside this for experience. So I give 4 codes for each one of these elements, 1, 2, 4. ICSX 1, 2, 4. Okay. The preventive measure is been taken from 32 literature reviews, 32 past researchers, past newspaper, past articles, and so on. So this one has been taken, and there is some sort of thematic happen within the literature review itself. So I code it as PM, preventive measure PM5 up to PM11. So it included social distance with the highest frequency of quotation 18. 6 and 7 is hand sanitizers and also face masks, 16 and 16. 8 on-premise sanitation, temperature detection, effective store payment checkout, and also store flow. So with regards to this quotation, it doesn't mean anything, but this one actually will be given the meaning after we interviewed the participant in the future. Then we will give meaning on this quotation. So right now the numbers is actually we just follow what we have here, but we will give the meaning of the numbers in the future. Okay. So this is the theory that we use, Maslow hierarchy needs. The customer experience is actually we put on the lowest part of the Maslow because we tend to go out to get our necessity, for example, basic needs. So we put it under physiological needs. When we want to get the basic needs, we actually the experience comes along with it, so we put it at the lowest part of the Maslow. And the safety needs is actually linked to the retailer's preventive measure. When this preventive measure implemented, so we feel safe. So this is the that's why it actually linked to the second stage of the Maslow. Okay, so the research methodology, the research design will be qualitative. The data analysis will be done in Atlas DI8. Even in the literature review, also I already do the data analysis with this software. And also the question will be on initial codes, which I'm going to share after this. Okay, the unit of analysis is 10, in-store customer, meaning that the participant must be a customer and must go to within the store, Malaysia retailer's store in Klang Valley, because the highest number of cases. Okay, and then the data collection will be face-to-face in-depth interview through Google Meet online video conference because of the COVID. And we have ethical consideration on consent form and video record interview permission as well for the participant. This is the initial quote, which is just conclude everything. So the conclusion is the experience being connected to physiological needs. The the preventive measure we connected to the safety needs, and also the paper wants to provide insight for the future research on preventive measure that affecting ICSX, and also the future finding can be utilized by government agency, retailers, and other policymakers. So thank you very much. So that's all from me. Okay, any other question? Any question?
Okay, thank you, Dr. Fatin. Is there any question?
Yeah.
Okay, Assalamualaikum Dr. Fatin.
Salam.
Dr. Fatin, I'll ask a lot of questions to make this session familiar.
Okay.
Okay, so Dr. Fatin, I'm very attracted to what you mentioned earlier in terms of we do shopping because we want to kind of release our stress, right?
Yes. Yes.
We miss that part. We miss that part actually.
Yeah.
Okay. So, in your opinion, you mentioned about preventive measures just now, right? So, do you think that what our country has been doing now in terms of having preventive measures for shopping, is it really efficient to prevent us from getting this COVID-19 disease?
Yeah, I think that's a very good insight actually. So for me, I think the guideline is there, but sometimes the guideline is like all over the place, and then people don't know what to implement or what not. So this study is actually wanting to know that as well, whether that the implementation of the retailers is very consistent since the beginning of the MCO or not. If let's say that this study can actually provide that findings, maybe the government will actually take a look at the findings and put more strict implementation towards the retailers. But as for me, because this is qualitative study, so the researcher is part of the instrument as well. As for me, as a customer, I'm a customer as well. Some customers are not able to actually they don't want to follow some guidelines, even us as well. But some retailers are very good at preventive measure, but some are not. Okay, but we as a customer, some are very good but some are not. So we want to know the what you call the variety of the findings within this study lah in the future.
You should write this for newspapers.
Yeah.
Is that depend on the review?
What do you mean by review?
Sometimes when we bought online, when we bought online, like from Lazada, so our intention is sometimes we influence because of the feedback. The feedback from the review, so the rating. So
yeah, I think that might be the part of the finding as well. If let's say like me, if I want to go to a mall, for example, so I will go and find information about the mall congestion, whether that the mall is okay with the preventive measure or not. So if let's say the congestion is not really much and the preventive measure is very good, so I will go to that mall. Sometimes the review from online as well is going to impact us as a customer to go for the retailers.
Yes, of course. Make sure there is no case of COVID there.
Yeah. Yes. Okay.
Okay, thank you very much.
All right. Okay. Welcome.
Thank you, Doctor.
All right. Okay. Welcome.
All right. We have last presenter.